Hi everyone, welcome back to Beyond Your Knowledge. So today we're going to be studying phenylketonuria or phenylketonuria, so also known PKU. Okay. Now, before we continue, I would like to share with you Philippians 4:4 and says rejoice in the Lord always. Again, I will say rejoice. That is a song that said that rejoice always. Okay, so yeah, pray without ceasing and everything, for this is the will of God. Okay, so yeah, this is a beautiful song. So you can find it, for example, in Hope channel. Yeah, it's on the internet. So they have several songs to download. They are very good. They have this one. Okay. Phenylketonuria. What we can learn about phenylketonuria. So first, before we continue, it is important that we learn the pathway of phenylalanine. Okay, so and that after that, so we can figure out what is the enzyme that is going to be affected that give the patient the diagnosis of phenylketonuria. So we're gonna start with the pathway. So we have, for example, phenylalanine. Okay, so phenylalanine has two ways to go. You can go here and can go here. So let's just start with the bottom one. Phenylalanine, one of the ways that can go is to phenylpyruvate. Okay, now this one has two ways to go. Phenylpyruvate gives you two results, and one of those is phenylacetate. Okay, and then the other one is phenylactate. Phenylactate. Okay, sorry. There we go. Yes. Now, phenylalanine also can go to tyrosine, but it's going to be using one enzyme, and this enzyme is called phenylalanine hydroxylase. Phenylalanine hydroxylase. Okay, now also here is going to have tetrahydrobiopterin, which let's just first is going to act just like this. Okay, so you're going to have tetrahydrobiopterin and can go to dehydrobiopterin, but to go there you need an enzyme, and this enzyme is called dehydrobiopterin reductase. Dehydrobiopterin reductase. Got it? Now, one time you have this tyrosine can go to two places. this is good. So tyrosine can go to two places, and one of the places is called DOPA, and DOPA can go to two places as well. One is called melanin, and the other is called catecholamines. Okay, catecholamines. Now, tyrosine, as we mentioned before, that can go to two places. I didn't put the arrow before, but yeah, can go to two places. One of those is DOPA. DOPA go to melanin and go to catecholamines. Now tyrosine also can go to be homogeneisate. homogentisate. Okay, so and then this one homogentisate can go to malylacetoacetate. Malylacetoacetate. There we go. But probably say, oh, but it's been for a while that I didn't see any enzyme. Yes, so now we're going to see another enzyme. So when you go from homogentisate to malylacetoacetate, you need another enzyme, and this one is called homogentisic acid deoxygenase. Okay, homogentisic acid deoxygenase. Now, then after you use homogentisic acid deoxygenase to convert homogentisate to methyl acetoacetate, the mallyl acetoacetate go to produce fumaryl acetoacetate. Fumaryl acetoacetate. This fumaryl acetoacetate go to a place which is go to be fumarate, and then this fumarate, where do you think that can go? Let's say this fumarate is going to enter into the Krebs cycle, or also known as a TCA cycle. Okay, TCA cycle. Yeah, so basically this is the pathway of phenylalanine, will lead you to phenylketonuria. So now we are going to learn some more information about phenylketonuria. Okay, so phenylketonuria, the classic phenylketonuria, or also known, as I mentioned before, the PKU. So is the most common form. It occurs most frequently in persons that are from Scandinavian descent. Okay, so it's more common in the Scandinavian descent. Okay, now what else? So those individuals, so there is, because it is a genetic disease, so it's going to be homozygous, but it is autosomal recessive. Okay, autosomal recessive disease. Now, well, they have deficit of the enzyme phenylalanine hydroxylase, and as you remember, is the enzyme I'm going to show you responsible to convert phenylalanine from here to tyrosine. So basically, in the patient that has phenylketonuria, they're going to have deficit of this enzyme. Okay, so now because they have this enzyme deficit, they cannot convert your phenylalanine to tyrosine, and then tyrosine is going to be essential in those patients. Tyrosine becomes essential. So that means that we need to give to the patient tyrosine. Okay, so because it's not produced anymore. Now this tyrosine, when becomes essential, an essential amino acid, so we need to give the the right amount, and also most patients receive adequate amounts of in their diet and do not require supplementation. So we need to, as I mentioned before, okay, so I mentioned that we need to give to them whatever they need, but also if we know which kind of food or all those things through diet, so we can produce, we can give to the patient through the diet the tyrosine that they need. Okay, now the excess of phenylalanine inhibits tyrosinase. Okay, so now that's mean because you remember that it's just basic thing. So if you cannot convert phenylalanine to tyrosine, so that means that phenylalanine becomes high, and if phenylalanine becomes high, so what's happened? So the patient inhibits the tyrosinase, so the excess of phenylalanine, phenylalanine inhibits the action of tyrosinase. Okay, now this one, the tyrosinase, is responsible for the production of melanin without E at the end. There we go. Now if you don't have melanin, if you don't have it, so what's happened? So when the patient doesn't have melanin, so they are going to have fair skin, okay, or light skin, or blue eyes, or all those things. Okay, so blue eyes or light eyes, light color eyes. Okay, color skin and eyes. Now the development is initially in those patients normal, so the development usually normal. Oops, sorry. But if you don't treat them by the age of 6 months, they can develop intellectual disability. Okay, so which is important to keep in mind, because as soon as we diagnose this patient, we need to work with that to avoid that the patient developed intellectual disability. Okay, now how I know, because the patient, when they born, we can see the skin. So let's see some clinical features here. Okay, so clinical features, so for example we mentioned fair skin, or light skin, okay, or light color. Also they are going to have the musty body odor, so you smell it, musty body odor. Also remember that when we check the enzyme, when we do the enzyme, so it's going to have phenylene hydroxylase, which is not you don't see it, but then you diagnose with that phenylene hydroxylase. Also all the findings in those patients is going to be seizures, it's going to be eczema, so basically are those. So now recommendations, so let's just hear some recommendations. So remember, avoid food with phenylalanine because we don't want that to become super high. Okay, also it is basically is that. Now all of those things, I think that we keep in mind so we can do better each time with our patients. And I think that with that we are done. And thank you so much for watching, and hopefully you learn something as I learn, and in Jesus' name that we can continue to be good doctors. We can do all things through Christ. God bless you.